Everyone, I'm Doc. In this video, I'm going to discuss chest pain. If you like this video and benefit from it, hit the like button, comment below, share and subscribe. I want to discuss all the causes of chest pain. I'm sure most of you have experienced chest pain at some point in your life. So I want you to understand clearly that chest pain can be caused by more than 20 diseases or more. First, for you to understand this topic better, I want you to understand the structure or anatomy of your chest or thorax. This is the anatomy of the chest or thorax. We have the front view of the chest, and we have the side view of the chest. So we have the structures that comprise the chest. From outside to inward, we have the skin, then we have the ribs. These are the ribs. Then we have the muscles. The red ones are the muscles. In between the ribs, we have the muscles. Then from there, we have this structure in blue. It's called the pleura. Pleura is a membrane that covers your lungs. This part that is attached to the ribs is called the parietal pleura. The other part that is adherent or attaches to the lungs, it's called the visceral pleura. Then we have the lung, and then we have the alveolar. This is the alveolar. We have the smallest bronchial tubes, which are called bronchioles, and we have the large bronchial tubes. These are the large bronchial tubes, which we call the bronchus. Then we have the trachea. Trachea is part of the chest, and also we have this structure in blue is the food pipe. Food pipe usually passes through the chest. Then we have the heart. We have the heart, which is at the center or in between your two lungs, and also there is one of the major arteries that come out from the heart, which we call the aorta. From this point, I want us to discuss the side view of the chest, because there are some of those structures that you cannot see better when we are using the diagram of the front view. The side view of the chest, we have the front part of the chest, the skin, then we have the lungs. This is the trachea or the windpipe. This structure that I've drawn in blue is the food pipe or the esophagus. And then we have the heart, this structure in red. The aorta is these largest blood vessels that arises from the heart and move downward through the back part of your chest. Then we have the backbone. The backbone part, it's called the thoracic vertebra. We have the backbone part of the chest. Backbone has several divisions. We have the neck part of the backbone, which we call the cervical vertebra. We have the backbone part, which is the thoracic vertebrae. Then we have the abdomen part, which is the rubber vertebrae, and also we have other two parts of the vertebra. So chest pain can arise from any of these structures that I've described here. These structures are divided into three. We have the bones of the chest, or the bones of the chest wall. The bones of the chest wall, we have the ribs. Then we have the sternum. The sternum is this bone here, or what we call the breastbone. And then we have the backbone. Then we have the joints of the chest wall. Joints means that where two bones meet, that one we always call it a joint. These joints in the chest wall include one. We have where the ribs attach to the backbone. That there is a joint. Then there is a joint where the ribs, on the front part, where the ribs attach to the breastbone. Then we have the vertebra itself, or the backbone itself, is made up of the vertebral bodies. So in between the one vertebral body to the other, that is another joint. So if a patient has a condition like arthritis, arthritis is the infection or inflammation of joints. Those joints can include the joints of the chest wall. Then we have muscles. Muscles include muscles of breathing. We have the external intercostal muscles. These muscles that are in between the ribs. We have the external intercostal muscles. We have the internal intercostal muscles, and also we have the diaphragm. External intercostal muscles and the diaphragm usually help you when you are breathing in, and internal intercostal muscles usually help you when you are forcefully breathing out. Then number 3 classification of all this structure is the soft tissue. Soft tissue, we have a variety of soft tissue in the chest. We have soft tissue that is before the lungs, that is the windpipe, and also we have the food pipe, and also we have the bronchus. Those are the soft tissue that is before the lungs. Then we have the lung itself. Then we have the soft tissue that surround the lung is the pleura. I've told you the pleura is a two-layered membrane that covers the lung. The layer that covers the lung is called the visceral pleura. The layer that covers the ribs or attaches to the ribs is called the parietal pleura. Then we have other structures that are in between the lungs. In between the lungs, we have the heart. We have the blood vessels that arises from the heart. Then we have this space. This space that the heart occupies is called the mediastinum. Mediastinum is divided into the upper mediastinum and the lower mediastinum. The lower mediastinum is subdivided into 3. We have the anterior, the front mediastinum. Then we have the midral. Midral mediastinum is the space that's where the heart occupies, and then we have the back mediastinum or posterior, where the aorta passes, the thoracic aorta. This is the aorta that when it arises from the heart, it usually move back and downward so that it can supply the structures around your heart and the structures that aid in breathing, and also it can move down further into the stomach or into the abdomen, where it will supply organs that are in the abdomen. So all these structures, if a disease arises from the heart, it can cause chest pain. If a disease arises from the main blood vessel, which is the aorta, it can also cause chest pain. If a disease arises from the lung, it can also cause chest pain. If a disease arises from the food pipe or the esophagus, it can also cause chest pain. If a disease arises from the ribs or the bones that surround the rib cage or the thorax, it can also cause chest pain. So today I want to ask to focus with the structures that are inside the chest wall. I'll do another video because this is a very broad topic. I'll do another video, part 2, where I'll be discussing those diseases that cause chest pain that are related to the chest wall. That is the bone and the muscles part and the skin. For now, I'm going to discuss those diseases that can cause chest pain, the diseases of the trachea or windpipe, food pipe, the heart blood vessels, the lungs, and the bronchus, and this outer layer that cover the lungs. Chest pain is usually of many varieties. Chest pain can be described into one, the site of chest pain, how the chest pain started, and also we have the characteristic of chest pain. Characteristic of chest pain may be sharp, it may be dull, Chest pain that arises from the heart most of the time is dull. Chest pain that arises from the lungs is sharp, or we usually describe it as stabbing. And also we have other factors like the relieving factors of chest pain. Sometimes you can have a chest pain that is relieved by maybe rest or when a patient hold a breathing. Also, we have other factors like is the chest pain moving toward another organ? We call it radiation, whether that pain is radiating. And also, we have other factors like we call aggravating factors. These are factors that worsen the chest pain. And also, for us as doctors, we are able to differentiate chest pain by associated symptoms. This means that those associated symptoms that can belong to the lung or to the chest pain that is caused by the lung may be different from those associated symptoms that are different that arises from the heart. So we have how we describe or how chest pain that is related from the heart, how it appears. Chest pain that is heart related is usually located in the central part. Central part, as you can see, the heart is centrally located, but it tends to be more located toward the left side of your chest. So a chest pain that is heart related usually may present as a central pain that is around the breastbone, and also it may be left sided. Then the onset of heart related chest pain usually occur within minutes. Heart related chest pain, usually we say it's heavy, it's squeezing, it's crushing, it's dull. It's like a heartbreak. Maybe for those who have experienced heartbreak, that pain is usually it's heaviness. It's a feeling of heaviness. Though that pain may radiate or move. It may move to the back. It can also move to the neck, to the jaw, to the shoulder, and most of the time it can also move to the left upper arm. Other issues about heart-related chest pain is that that pain usually can get relieved when you rest. Heart-related chest pain most of the time is worsened by activity or exercise, but when you rest, the pain may disappear. Then associated symptoms that related to heart chest pain is that you may have other signs and symptoms like shortness of breath. You may also have cold sweats. You may also have dizziness, headache. You may also have weakness, fainting, and also you might also experience nausea and vomiting. Nausea and vomiting most of the time is related to what we call a heart attack. Also, we have those causes that come from, or the causes of heart-related chest pain. One, we have a disease we call the heart attack. What is a heart attack? Heart attack occurs when a blood clot usually obstruct coronary artery. Coronary artery is the blood vessel that supplies your heart with blood. Your heart usually needs oxygen. This oxygen has to be delivered through the blood. So if a clot can happen in a blood vessel, this clot will obstruct the blood flowing to your heart. Then if your heart does not get oxygen, the cells may tend to die. That's what we call a heart attack. Number two, we have what we call angina. Angina is a situation where big plugs are like cholesterol plugs. Cholesterol plugs can grow slowly inside the blood vessel. The innermost layer, which we call the tunica intima, can develop this cholesterol. This cholesterol will grow obstructing the hollow space where the blood flows through. This one will reduce the blood that is flowing to the heart muscles. In case you do an exercise, when you do an exercise, more oxygen is needed, hence more blood flow is needed to reach to that area. Now, because the blood vessel is narrowed, the blood vessel cannot get enough oxygen, making the muscles of the heart to die or to experience what we call ischemia. Ischemia is a lack of oxygen within the cells. Other reasons, we have aortic aneurysm. Aortic aneurysm is this diagram I've shown here. This is it's a balloon-like bulging out of the aorta. This happens because the wall of the aorta is weak, and also people who smoke make smoking can make the wall of the aorta weak. That weak point will bulge out. This part may irritate or may have a friction with the vertebral column, resulting to chest pain. Other causes of heart-related chest pain, we have aortic dissection. Aortic dissection is mostly a complication of high blood pressure. When blood is pumped with a high force or high pressure from the heart to the aorta, it may end up shearing or tearing off or splitting the different layers of the aorta. Aorta has the innermost layer, middle layer, and outer layer. So blood may split up this layer. This will make blood to try to leak through the split part, making you to have a chest pain. Other causes of heart-related chest pain, we have myocarditis. Myocarditis is the infection or the inflammation of the middle part or middle layer of the heart. Your heart has the innermost layer, which is endocardium. You have the middle layer, which is myocardium. Myocardium contains the muscles. So these muscles can get infected with bacteria or viruses. And also the last one, we have the pericarditis. Pericarditis is the infection and inflammation of the outermost layer sac. Your heart has it's like a sac that usually cover it. This can get infected, resulting to chest pain. Other issues that can result to chest pain, we have lung-related causes. Lung-related causes, we have pneumonia. We also have pulmonary embolism. Pulmonary embolism is when blood clot, especially from those patients who have a blood clot in the deep veins of the lower legs. It's called a DVT. This blood clot can dislodge and it will move with the blood and it will come and lodge within the blood vessels that supply your lung, resulting to pulmonary embolism, causing severe chest pain. Other causes of chest pain, we have a collapsed lung. Collapsed lung can occur maybe when you are someone has sustained a stab wound or a knife stab. This one will allow air from the atmosphere to enter into this space between the ribs and the lungs, which we call pleura. If air leak into that space, the pressure, atmospheric pressure, is higher than the pressure between this space, intrapulmonary pressure. So air will leak in, collapsing the lung. And also, we may also have other causes like cancer, cancer of the lung or cancer of the trachea or cancer of the bronchus. Other reasons like TB and other lung infections. Also, we may have other reasons that can result to chest pain, which they fall under category of digestive system. You have seen that the food pipe or the esophagus passes through. The esophagus connects the stomach to the throat. So food has to pass through the esophagus to reach the stomach. If you have a heartburn occurs when stomach acid flow back into the esophagus, into the food pipe. Then this acid will burn the innermost layer of the food pipe, resulting to swelling of the food pipe or inflammation. This swelling of the food pipe will result to a disease we call esophagitis. Esophagitis will cause chest pain. You will have pain that will feel like it's a chest pain. Then we have another swallowing problems. Swallowing problems may occur, especially for those people who have severe vomiting in pregnancy. When you vomit so many times or you stretch to vomit, this stretching may tear the food pipe, resulting to what we call Mallory syndrome. This tear will make you feel a lot of pain when you are or a chest pain. And also we have an issue like gallbladder problems, that is the infection or inflammation of the gallbladder. Gallbladder is located in the right upper side within the liver. Sometimes when you have a problem with the gallbladder, it may appear like you have a chest pain problem. So from that point, we should note that I'm going to do another video where I'll be discussing chest pain that can be caused by chest wall. So follow and subscribe Wahenya Doc to watch part 2 of the chest pain. Thank you.